Everybody. I'm Dr. Rochelle Brittingham, and along with my co-PI, Eileen Sparling, who was actually the lead PI on this project, we are delighted to be able to share with you the impact of COVID-19 on people with disabilities in Delaware. We found there were sort of three major thematic areas that emerged as we were going through what sort of little data was available. But individuals with disabilities really did face disproportionate risks, devastating impacts, and there were stories of great emerging resilience within this community to make sure that needs and services were met during an incredibly difficult and complex time. On a personal note, like this was probably one of the most fluid projects I've ever worked on in terms of what we had laid out to do, what we thought might be available, and then what we discovered was available as we were going through our different contacts and the different information being published. Next slide, please, Eileen. It was funded through the Freedom Center. This came via one of the COVID grants. So the RFP came out in July of 2020. We applied. We were awarded it in August of 2020. But then we opted not to start it, in fact, until July 1st to enable a full calendar year of 2020, kind of looking back to see what data was available on individuals with disabilities during the time of COVID, to really dig into what was happening and how things might have changed. Data collection, and we worked on this project basically until the end of July of 2021. So we used those 6 months to look back at 2020. And next slide, please, Eileen. And one of the pieces of information that we came across, or one of the quotes rather that we came across, was this idea of triple jeopardy. That this was what people with disabilities were experiencing, okay? They were differentially affected by COVID-19, the increased risk of poor outcomes from the disease itself, reduced access to routine healthcare and rehabilitation, and the adverse social impacts of efforts to mitigate the pandemic. We saw this come up again and again in our conversations with people and some of the lit review that we had been doing. And it was just a very striking quote that this was what was being seen nationally as well. Next slide. So when we set out to do this, we thought our methods were going to be, hey, we're going to do a literature review using media sources. We were going to be able to gather different reports and documents. And as we were sort of monitoring what was coming out, it became apparent that there wasn't going to be a lot of information. And so we had to change our strategy for data collection. And instead of it being straight quantitative or straight qualitative, we started trying to blend the two. So we did continue to look for any and all quantitative data that might have been available for 2020 with people with disabilities. We did the lit reviews using some of our graduate students, going through the different databases to see what articles were out there. We ourselves were not doing any new data collection. We were not interviewing and coding. We weren't putting surveys in the field or anything like that. We were just trying to gather all of this information and see what was available. And so we were like, we need more people. We need the people who are plugged into the disability community. And so we were doing listening sessions as well, where we invited some key players to basically talk to us, not as a stakeholder, but as a, do you have data? Do you know of any data that's out there? Because we took the information that came to us and we organized it into the different life domains that are usually seen in healthcare, in the community. So it's health, access to healthcare, food insecurity, home health services, transportation, employment, survival rates, death rates, etc. And so we did that. We took all of this information, we sort of coded it into these different categories, and then we were able to look category by category at the impacts that the pandemic was having on people with disabilities. We recognize also that at the time, the situation was still very much emerging. In early 2021, vaccines were just becoming available. There was a lot of discussion surrounding what was going to happen in the disability community with respect to vaccines. We also encountered the fact that the disability status itself is not routinely collected in COVID-19 encounters. And so very often people were like, we just don't have data on the community because we don't ask about it. So we had to go to some of the other divisions in the state. For instance, the Division of Services for Aging and Adults with Disabilities. So that's DSAA, DSAPID. There we go. And then DDDS, to say what data is out there. But then we also recognize that there were blind spots in how that data was collected because the person has to be able to interact with that division in order to be counted. So there were still individuals in their homes receiving services just from their family members and friends that were otherwise not being counted. Next slide, please, Eileen. So who in Delaware is the disability community? That was our focus area. And using some of the BRFIS data, 1 in 4 Delawareans indicate they report having a disability. And you can report in multiple ways that you have a disability. And so the breakdown is there. And also of note, especially because when talking about long-term care facilities, that's where some of the disproportionate risk and the devastating impacts came out of, that almost 7% of people with disabilities over the age of 65 live in nursing homes in Delaware. And this fluctuates slightly nationally as well, but within the state, that was the total number. Next slide, please. Within the disproportionate risk category, knowing that people with disabilities have higher rates of chronic conditions or comorbid conditions, so you have multiple diagnoses, as well as the fact that congregate settings are much more likely to be seen with people with disabilities than those without. And even for individuals who are in their homes, services and resources are very often organized in order to be able to come to them. Within the incomes and economics of how having a disability, sort of works for some people, very often you're talking about limited access to income, okay? Somebody maybe isn't working at all, or the places where they are working were shut down because it was service-oriented industry, and that resulted in unemployment. We also discovered with some of the stuff that we were doing that information like materials itself in order to be able to communicate what is going on with COVID-19 was inaccessible or not available to people with disabilities. Next slide. We did put in a couple of tables here that kind of illustrate some of this, like the rates of conditions increasing COVID-19 risk in Delaware by disability status. That the column on the right-hand side with disability versus the left without disability, I mean, all the numbers increase if you have a disability and your risk factor there. Next slide, Eileen. Thanks. And so devastating impacts here within this was using some of the information that we got from the Division of Developmental Disability Services, residential rehab service recipients, the number of deaths and like the percent mortality for people with disabilities was fairly significant. And I don't necessarily mean this like on an alpha level, but just it is striking. These are people, these were their experiences, and this was, the result of COVID-19. At this point, I'm going to turn it over to Eileen so she can walk us through the latter half of the presentation.
I just really wanted to share a little bit about this story map option that we used for this project. We also did sort of the typical report. There's a 75-page report or something like that that sort of goes through all of these findings. But when we started to work on this, I had been thinking about using a story map for a project, and I just hadn't found the right one yet. And I think this particular topic really lent itself to just sort of including powerful images and visuals and thinking about also who the audience was. You know, the Freedom Center for Independent Living, in terms of asking us to do this project, really wanted to share information, not just with researchers, but with policymakers and legislators and the disability community, to really kind of capture the impact and the qualities of this pandemic that really, I think, revealed some of what I was thinking of as sort of the cracks in the system of service for this population, and to highlight that so that moving forward we can make changes. So some of these, the images, and the link to the story map, if you haven't seen that yet, is at the end. I was going to try to put it in the chat. Rochelle, maybe you can do that, because I thought I had set it up there, but I think when I switched screens, I lost it. So this really, the platform allowed us to sort of tell the same story that's in the report, but also use photographs and interactive maps and timelines and links to really allow sort of the depth of this project. It was really, you know, as Rochelle sort of alluded to, this sort of got broader and deeper than we had anticipated. Maybe that was naive, but it was really a complex story. And I think people come to this issue with a different mindset. So everybody kind of has their own lens to this. And this story map really allows you to dive into this in a very, you can browse through it. It's more interactive. You can follow the path that you're interested in. If you're interested in the healthcare piece, you can go down that. If you're interested in schools or employment, you can sort of follow that. It's easier to browse through, and there's a lot there. So I'm going to just share a couple of screenshots to just sort of illustrate some of the things that it allowed us to do. So this is a map that is built in, you know, it's a GIS map that's embedded into the story map. But for each of these dots that are on this map, you can click on it, and what you get is the detail of that particular nursing home, how many cases there were, how many deaths, for residents, for staff, and it really gives you, you know, the ability to dive deep for your particular area or what you're interested in. And that's something that if you did that kind of data in a report, it would just be pages and pages of tables. And this sort of allows you, it's there, it's available, but you can dive where you want to dive. Another, let's see, we also, Rochelle mentioned the life domains, and that was part of the original task, was to really explore these life domains in a way that people can come to it. And this is just sort of, it was almost a sort of parallel story map to the actual report, that if you want to look at any of these sections, you can do that. And then let me see if we can, the other thing I just wanted to say about some of the photographs that we used in this, we were putting this together in, you know, 2021. And so we're, you know, a year or so out from those original, you know, dark days when we didn't really know what was happening. And I have to say, just the photographs alone, really, some of them really brought me back to those moments. And I think you know, I'm a visual person, but it was just like those scenes of the drive-by funeral and the people visiting through the window at a nursing home. All of those things just were, I think, really powerful in a way that you don't see in a visual report, you know, in a linear report. So let's see if this, okay. Are you seeing the story map? Yes, okay, great. So it's really a website, but it has a lot more flexibility in terms of the way that you can move through it. So we've sort of captured some of those photographs. There's a timeline in here that kind of takes you through what were some of those significant points. There's also, you know, the data is there, and I think there were some things that came across, and this was one of the statistic that's here. You know, residents of long-term care facilities were less than 1% of the population, but 43% of all COVID deaths through June happened in those places. And this, you know, the population is one that was at such risk, but also the impact was just tremendous. So one of the areas here that, let me see if I can just get back to, you know, this piece here. This is a thing, one of the things that we heard back from folks was just that there's so much here, and we know that. So I encourage you to take a look at, you know, kind of dive into this and explore it and think about ways that for projects that you have where the audience or the topic lends itself to this kind of visual presentation, to consider that. And I'm going to stop sharing just from a time perspective. So thank you, and if there are questions, we're happy to talk about this. It was really an interesting project for us.